Hello, and welcome to the presentation on heart health for women. My name is Marcus Harris, and I've been asked by Stephanie to speak to the ladies of Delta Sigma Theta regarding heart health for women. Let's get started with our presentation. Okay, as we discuss heart health for women, again, my name is Marcus Harris. I'm CEO of Visions Physical Therapy, and I've been a physical therapist for going on 23 years. With heart health for women, there are several key components to making sure you have a healthy heart. And today we'll be talking primarily about exercise, but in addition to exercise, also dietary intake and water is very important. So when you talk about heart health for women, let's go over three different stats. 60 million women in the U.S. are living with some form of heart disease. Heart disease is the leading cause of death for women in the U.S. Knowing facts about heart disease can help you take steps to protect your heart and seek treatment if needed. So today we're going to talk about three common types of heart disease in women. Now there's several others, but the three most common types of heart disease are coronary artery disease, arrhythmia, and heart failure. So the first one we'll talk about is coronary artery disease, CAD. Coronary artery disease is a disease which is caused by plaque buildup in the walls of arteries that supply blood to the heart, called coronary arteries. Plaque is made up of cholesterol deposits. Plaque builds up, causes the inside of the arteries to narrow over time. This process is called atherosclerosis. In this diagram right here, you'll see the coronary arteries, which again are the arteries which supply oxygenated blood to the heart. When the artery is clogged, the heart can no longer receive the amount of oxygenated blood to function properly, hence the name coronary artery disease. A couple other factors regarding coronary artery disease. What are the symptoms of coronary artery disease? Angina, which is chest pain, discomfort, common symptoms of CAD, narrowing arteries that can cause chest pain. For many people, the first clue of coronary artery disease is a heart attack. Chest pain, angina, weakness, lightheadedness, fatigue, pain or discomfort of the shoulder, shortness of breath, and over time, coronary artery disease can weaken your heart muscles. The next type of heart disease that we'll discuss in women is called arrhythmia. Arrhythmia is a condition when your heart beats too slow, too fast, or irregular. A common example of arrhythmia is atrial fibrillation. In this diagram right here, you'll see the normal heart and then the irregular heart. With AFib, or when AFib occurs, the upper chambers and the lower chambers are not coordinating, causing the heart to beat too slow, too quick, or irregular. This is an example of arrhythmia or atrial fibrillation. With arrhythmia, some people who have this type of dysfunction, they have it and don't know the symptoms. Others may experience one or more of the following symptoms: irregular heartbeat, heart palpitations, lightheadedness, extreme fatigue, shortness of breath, or chest pains. And the last type of heart disease in women that we'll discuss is heart failure. Heart failure is when your heart is too weak to pump enough blood to support other organs in your body. This condition is serious, but it doesn't mean your heart has stopped beating. In this diagram right here, on your left, you'll see a normal heart where you have good oxygen-rich blood pumped to the body. On the right, where you have heart failure, you have a reduced amount of oxygenated blood being pumped to the other organs in your body. And also you have dilated ventricles. So as we discuss the common types of heart disease, there are also several other medical conditions and lifestyle choices that make women high risk for heart disease, including high cholesterol, smoking, diabetes, excessive weight, unhealthy diet, physical inactivity, drinking too much alcohol, and stress and depression. So, how do you reduce your risk of developing heart disease? A couple things. Know your blood pressure. Talk to your doctor about diabetes. If you smoke, stop smoking. Talk to your doctor about cholesterol and triglycerides, which can contribute to plaques and causing coronary artery disease, like we discussed earlier. Make healthy food choices. Limit how much alcohol you drink. Manage your stress level. And one of the key factors is get at least 150 minutes of exercise, physical activity each week. And this is what we will focus the rest of our presentation on. So, the remarkable benefits of 30 minutes of exercise every day. Finding time to regular exercise can be challenging, but dedicating just half an hour each day to cardiovascular workouts can have a profound impact on your overall health and well-being. Cardio exercise involves activities that raise your heart rate and increase your breathing. All right, so this right here is just an example of exercise in the heart. As you exercise, you increase your heart rate. You increase your heart rate, you increase your cardiovascular system. So, some of the remarkable benefits of 30 minutes of exercise in the cardiovascular every day. Enhance heart health, weight management, boost mental well-being, increase energy levels, and stronger bones and joints. So what does cardio exercise mean? Cardio comes from the Greek word cardia, which means heart. Simply put, exercise typically count as cardio if it involves intentional, coordinated physical actions that raise your heart rate for an extended period of time. A good cardiovascular workout will have you consistently breathing faster than you would while resting. The results, more oxygen in your blood for your heart to pump to the rest of your body. So most people think of cardio as only cycling, running or jogging, rowing, swimming, walking, hiking, cross country, skiing. Now these are good forms of cardio, but they're not the only forms of cardio. So cardio exercises you can do at home because we're all busy and oftentimes we don't have the time to do the previous things I just discussed. But people do not need a lot of equipment for cardiovascular exercise. There are various cardio workouts a person can do at home with no or minimal equipment, such as marching, jogging in place, dancing, music, mountain chairs, and burpees. So let's go over some at-home cardiovascular exercise that can be done. High knees. The picture right here, the lady lifted the knees up to the chest. Also jump rope. That's a good form of cardio. You got jumping jacks. That's a great form of cardio. You got jump squats, where you squat all the way down to the ground and jump up as high as you can. You got split squats. They're very good. Bear crawls. They're very good. Another one is bear planks, where you're on your tiptoes, your knees off the ground, and you're just slowly bringing your arms up and down. You got butt kicks, lifting your heel towards your butt. Walking upstairs at a brisk rate, great cardio. And then also high knees. How long should you work out? We discussed this earlier, but let's talk about what the American Heart Association recommends. They recommend achieving at least 150 minutes of moderate intensity heart pumping exercise for 75 minutes of vigorous intense exercise spread out over most of the days of the week. If you're just getting started, the cardio exercises opt for moderate intensity level as the initial setup in order to better allow your muscles and joints to get used to the movement. So, as we discuss heart health for women, let's go red. February is American Heart Health Month. And as African American women, it's very important that you understand heart disease and how it impacts your life. Ladies of Delta Sigma Theta, go red and congratulations.